I just want to start by acknowledging the traditional owners on the lands we're on today, the Turrbal and the Yagara people, and pay my respects to their elders, past, present and emerging, and particularly recognise that the places that QUT is on at this campus and at Kelvin Grove are significant places, including for the production and the gathering and the sharing of food. I'm going to start a little bit with who I am, just because I thought I was considering what my contribution might be to this discussion, so I wanted to, I guess, position myself a little bit. I'm a dietitian by training. I began my career in a small country hospital in Queensland and worked in tertiary facilities, and then headed a small NGO in nutrition called Nutrition Australia. Then I went to work for Queensland Health and as a public health nutritionist when the state's first public health nutrition team was emerging. Here we are tracking the cost of food in remote areas of Queensland. I then was the director of a public health nutrition team in Queensland Health, which included Aboriginal and Torres Strait Islander services in the community controlled sector. Then moved on to corporate office in Queensland Health, where we gave ministerial advice, including advice on the investment of programs, and here we are looking at growth monitoring in Cape York. Managing social marketing campaigns for the department, and then I moved on to academia in this sort of, I guess, the second part of my career. But my PhD followed on from a gap that we had in community and public health nutrition policy in Queensland at the time. At that time too, I was missing the policy side of things, being in academia. So I was the Food and Nutrition Chair for the Public Health Association of Australia for quite some time. And in that role was part of representing that organisation on several food regulation processes and bodies. And then, as being an academic at universities does, it lends you into working internationally more. And so I've worked with a number of different countries, the Department of Prevention in Italy and Vietnam, connecting with people from around the world that are involved in food regulation, and including with the UN Food and Agriculture Organisation. So I'm coming to you very much from the position of a nutritionist. So what are nutritionists trying to achieve, which is the spirit of what we're trying to use regulation to achieve. This is the United Nations goal for healthy, sustainable diets. So that's the language you use now, that they're dietary patterns, so not individual nutrients or foods, that promote all dimensions of an individual's health and well-being, have low environmental pressure and impact, are accessible, affordable, safe and equitable, and are culturally acceptable. The aims of sustainable healthy diets are to achieve optimal growth and development of all individuals and support functioning and physical and social well-being at all life stages for present and future generations, contribute to preventing all forms of malnutrition, reduce the risk of diet-related non-communicable diseases, and support the preservation of biodiversity and planetary health. Sustainable healthy diets must combine all dimensions of sustainability to avoid unintended consequences. So it's quite a complex goal, I guess, is what I'm trying to communicate with that. In Australia, then, we convert this into the Australian Dietary Guidelines in terms of what foods are going to help us to achieve that, and they're the types of foods that you, I guess, imagine the types of messages that we have there. It's important to note that these are currently under review for the first time in 10 years. So which foods to eat more of, which foods to eat less of, and particularly also a promotion of encouraging and supporting breastfeeding. They were the main things I wanted you to take note of there. And so how are we tracking against that? Well, globally, this is the burden of disease work on the contribution of these risk factors contributing to the burden of disease. So you can see dietary risk factors are the fourth down there, but when you look at the contribution of diet to other risk factors, and can imagine the complexity and the calculation of that, if you're familiar with global burden of disease, you can see that nutrition represents a huge contribution. What we eat has a huge contribution to the burden of disease. In Australia, similarly, the contribution to the burden of disease is very high as well. So how are we eating in comparison when we look at that in terms of actual foods? So this is the proportion of Australians who are not eating the recommendations. So you can see for fruit and vegetables, 99.6% of male children don't meet the recommendation. 96.5% of adult males, 95% of women don't meet the recommendations for that one particular food group. But you can see across all food groups, we're well off what the recommendations are saying, and that's bearing out in the contribution to disease. So these are all things, I guess, to keep in mind in terms of what foods we are wanting to people to eat, and therefore how we might use a regulatory approach to achieve that. So just a note that globally, when you look at the sorts of foods we're wanting people to eat, and that's very regionally quite different from one place to the next, very much maps to the resources of those countries, but really far off what we know the evidence is saying is best for health and sustainability. From a climate change perspective, we know that food is a big contributor to climate change. We also know that this is going to impact on the cost of food, the availability of food, and the quality of that food. Okay, so what contributes to the way that we eat? This is a diagram we show most of our students around the fact, and I guess I'm just showing you these things because they map into the sorts of arguments food industry will make. There are individual factors, factors around the household and the setup you're in, the physical environment of where you live, work and play, and then regulation, I guess, fits into that broader environment of the settings that we're in and the policies that govern them. The high-level panel of experts puts together this food system diagram on the determinants of our food supply. And I guess to say that there are, when we think back on the definition of healthy sustainable diets, the various impacts on the food that we eat and the various kind of goals and roles that food plays in our lives, there's a complexity in regulating food that doesn't exist for other things, for example, tobacco. Also, the fact that everybody eats multiple times a day, so every member of society has a vested interest. There's discussion around every mouthful you take as a political act, but food is, I guess, a different being in terms of potentially other health issues. Some authors talk about a gastronomic revolution, but where food is available, what type of food is available, when is available, is quite crazy. Obviously, in these environments, ultra-processed foods are much easier to be in the food environment rather than core foods that are the foods that we want people to eat. There's a commodification. The commodification and the economic rationalism around food is very strong. And even around nutritionism, so I've got an image there, I guess, of liquid nutrition, which is a huge market which uses nutrition to promote foods that we still are not particularly interested in people eating. I took this photo at the Milan World Expo, which focus was on the future of food, and every plant on the site was edible. So here we had a vertical garden of lettuces over the top of a Coke machine, a Coke vending machine. And that's the reality of, I guess, what's happening. I think these are some photos I took on the QUT trip to Vietnam. But I think middle-income countries are particularly where you see this very stark nutrition transition happening at all stages of the food system. So in terms of what sorts of foods are produced, so at the top we can see really small regional farmers involved in farming fish and vegetables that were not usually in their food supply. So there's impacts there in terms of biodiversity and the nutrient density of the foods that are produced. Where foods are sold and how foods are sold in terms of supermarkets and the sorts of types of foods that are more attractive to trade in supermarkets are more processed foods rather than fresh food markets. And then even in the food service sector in terms of how quickly foods are able to be used, transported and wasted. So changes all across the food system. In Australia, we have, I guess this slide comes from data in Australia as opposed to just being an interesting picture in and of itself, around the concentration of our food supply. These are supermarket products, but they speak to, I guess, the power of a fairly small number of companies across our large food supply. And when you look at the suppliers of seeds and grains and fertilisers, you see this as well. So I guess how do we use a law to achieve food and nutrition goals as a health professional, and having come from, I guess, being involved in advising on policy from an advocate organisation perspective, but also within government as well. We use this really old diagram still. You'd think we'd come up with something more, but it rings true. The Ottawa Charter has been around for 1,000,000 years, but it talks about this multi-strategic approach to any health issue, that building public policy is a really huge cornerstone of that, but then at the same time you're looking at creative supportive environments, reorienting health services, mobilising your community and developing personal skills, but that policy fits within that suite. What does that look like in practice? This is a national obesity strategy in Australia where you can see we've got 3 ambitions. Ambition 3 is around treatment and early intervention and care, which is around the orientation of the healthcare system. We've got ambition 2 around the individual, and then ambition 1 around creating supportive environments. So I've highlighted there some of the ones that are particularly interface with the regulatory environment. So they're around the information that's given to consumers. So that might include labelling and advertising, marketing to children, the affordability of food, so the use of pricing regulation, the reformulation of food in terms of processed food, and the accessibility in terms of where food can be sold and built environments in general. In the National Obesity Strategy is an interesting story in itself. We had a really great national food plan, which was looking at food across the continuum, across all government departments. It lived for a very short period of time. It's been a really long, Australia still doesn't, its last national nutrition policy, well, its current one is from 1992. There has been so much advocacy for a revised national nutrition strategy, probably better in the context of a national food plan, for such a long time. The National Obesity Strategy was pragmatically something that we thought would be the next best thing. The government was interested in doing that. It's been out nearly 2 years now with very little committed investment in that. For example, the Queensland's response to this plan, I think, was trying to get through Cabinet before the end of the year, so we don't know yet whether it actually has. So I guess then when we look at the regulatory framework, this paper's one that I use to guide my work sometimes, then you've probably got more comprehensive thoughts in your heads in terms of coming from a law background, but this is, I guess, some various places in which we could use regulation to influence the food supply. So a few years ago, I was asked by the Queensland government, who were doing this work on behalf of COAG, as it was at the time, to do a rapid review on regulatory approaches to address childhood obesity. We had several restrictions on that review, but we found, I guess, and we looked across internationally at current approaches and their effectiveness, and our findings were that activity is really only limited to a fairly small part of the food system when we look at how we might be effective in addressing healthy and sustainable food. Regulations are very unlikely to be effective when they only exist on their own. They need to be supported by a whole lot of other activity in health, and I think you spoke to that a little bit in terms of tobacco. That monitoring and public reporting, so to say it was around trans fats or reduced sodium content, needed to be, the public reporting was a really important part of keeping industry held to account. And the evidence of voluntary approaches is incredibly weak. Australia's food regulatory system has revised its aims in 2017. There was a lot of work to be very explicit around the role of the regulatory framework in improving the quality of the food supply from a nutrition perspective. And so I've highlighted that aim here. So I'll spend a little bit more time talking about then how we're currently using it, and really only in those two small aspects. So from a composition perspective, we've got some mandatory guidelines on infant formula, commercial baby foods, voluntary reformulation agreements with the National Healthy Food Partnership, which has been largely ineffective. Mandatory labelling, the nutrition information panels has come in certainly over my career as a mandatory thing. Health claims and menu board labelling in some states, so that's not a national thing, that's a state thing. Health Star rating system is voluntary. Added sugar labelling, I think it must be about 12 years now that that's been tried to become mandatory. It's amazing how many health minister, food minister meetings that has gone to. From an advertising perspective, there's the MAFE agreement, but the funding for the policing of the MAFE agreement has decreased over successive governments. We currently have a private members bill on healthy advertising to children, but it received very little discussion in Parliament, and a voluntary, the industry has, I guess, responded with a voluntary industry code. Because how are these things going? The Health Star rating system has had a very, very long time, 10 years for that system, and it really, to come into place, I was on the Public Health Association group at that time. It has a huge political interference. I've just pulled this up from a couple of years ago when David Littleproud was very outspoken when one of the reviews of the Health Star rating system changed the, how fruit juice would be described. I've got a picture there of 4 different drinks that I purchased that day at the supermarket, none of which were using the Health Star rating system anyway. So it was of no assistance in helping you select which drink might have been better for you anyway. So this voluntary Health Star rating system gets tinkered around the side, but yeah. The example of my own children, this is one of their drawings of the first time we were on a family holiday, beach area, raining. The only publicly accessible playground was at McDonald's. So this was her drawing at her preschool orientation day a week later. This was in their supermarket and in our children's hospital foyer at the time. Pretty much every sport they've played has been sponsored by a junk food company, including rewards for those teams. the gamification as they got older in Snapchat, and I would say on Schoolies Week as they got older too, lots of promotions for them to go to McDonald's during Schoolies Week. And then as they got older again, most of their friends got jobs being paid fairly unethical rates as well in that sector. So this is all in a time of a voluntary children's advertising code, sat in many meetings where mandatory legislation was attempted to be discussed, and food industry very successfully lobbied for voluntary codes instead. And I notice now, just in the last couple of weeks, another voluntary code has been launched. This is some photos I took at the United Nations Standing Committee for Food Security at the FAO headquarters in Rome, where again, food industry paid for the fees for a lot of their own people to attend. They have the same number of membership of that committee as government and as the NGO, the civil society sector. The Australian government sends people from the Department of Agriculture to represent us on this committee rather than health. These are the companies that were sponsoring the sessions that I went to. So they represent everything from fertilisers, grains, seeds, to pharmaceuticals. This is some work that has been done in by one of our colleagues, Catherine Cullerton in Queensland, around how close nutritionists and lobbyists were to, and health organisations were to decision makers. And it's a complicated picture, but essentially what it's saying is that we're all talking to each other and not to the decision makers, and food industry is very effective at getting to decision makers. So I guess challenges to food regulation. This is my last slide. Globalisation of the food supply. We've got a lot of food from nowhere. Think about even modern slavery and how do you work out how cinnamon was produced in Special K corn, breakfast cereal. Australia's responsibility in the food it produces for other parts of the world, so we can think about the undermining of Australian dairy farmers, undermining breastfeeding in China as an example. Investment in policing of mandatory regulation is very poor. My experience of that in Queensland government showed that very much. We only prosecuted successfully once. And the review of the Fsanz Act seems as though that will be weakened even further. Our review of voluntary regulation, we are not on track to meet the target of voluntary uptake of the Health Star rating system by 2025. The Healthy Partnership Agreement, which was looking at reformulation of the fast food sector, is nowhere near its target. There is a really, we spoke a little bit about the changing nature of the marketing and promotion of food. Social media influencers are very difficult to regulate, and food industry are targeting, for example, mother entrepreneurs. Meal delivery services like health claims on Uber Eats are not going around regulation requirements. For example, we have compulsory menu board labelling, but it doesn't cover meal delivery services. There's a lot of small-scale cottage producers, which are, I guess, on the brink of therapeutic goods versus food, and which legislation covers that most. And then the use of AI, particularly in the marketing to children, and the gamification is quite significant. The WHO in Europe, I think, is probably the closest to regulating there. And then I guess that other aspect of when is it food and when is it a therapeutic good, which is really problematic. So well off our target of these healthy, sustainable diets.